Other stories, the country is experiencing the third and very critical stage of COVID-19. Echoing the sentiments of the Health Cabinet Secretary Mutahi Kagwe, the Kenya Medical Association Chief Executive Officer Dr. Elizabeth Gitau has called on individual responsibility in the fight against the virus, even as COVID-19 patients continue to fill the intensive care units. She has also added that no confirmed case of COVID-19 variant in the country yet, and no symptoms attached to the speculations by the public concerning the flu that has been thought to be a symptom of COVID-19. Robert Oma went deep in a bid to explain this.
Thank you for joining us. My name is Robert Oma, and today with us here we have Dr. Elizabeth Gitau, the Kenya Medical Association CEO, and we're here to seek clarification on whether the country is experiencing the new COVID-19 variant. So, Dr. may you please enlighten us concerning this?
Currently in Kenya, I would say that we have not yet officially reported any new variant of the COVID-19 infection, and surveillance is ongoing to actually look at the genetic composition of the virus going around to determine whether we actually have a new variant in place. Symptoms per se do not indicate whether we have a new variant or not. It has to go through genetic, they have to look, scientists need to look through the genetic composition to look whether we actually have a new variant or not. What my message to the public is not to get worried per se of new symptoms coming in. What you should be looking out for is, one, to prevent transmission of the virus. Because the more transmission that happens, the more the virus jumps from one person to another, the more likely a change is happening.
Now, from the Health Ministry desk, do we have hope as a country?
For sure, we are actually going through a third wave of COVID-19 pandemic in terms of the numbers have been persistently rising over the last few weeks. Hospitals are actually seeing an increased number of patients being seen because of the COVID-19 infection. Our ICU's numbers are actually rising. So for sure, Kenyans need to be a bit more cautious in terms of ensuring that they are actually taking care of themselves to not get COVID-19 infection, because for sure we are actually going through another wave. Variants will come in, or mutations of viruses will come in. The more people get infected, the more likely you actually have to have new variants. So if our infection rates continues, it will not be new that would actually have new variants here in Kenya. So what we would hope is that it will be less virulent, but my biggest hope is that we'll continue observing the COVID-19 prevention measures so that we do not end up there.
Thank you so much, Dr. Now, it is evident that there is no official information from the Ministry of Health concerning the new variant, but what still remains clear is that the Ministry of Health protocol should be observed to curb the pandemic. Robert Oma, Switch TV, Nairobi.